Hi guys, my name is Sam YG.
This is Tony.
And my name is Slick Rick, and we're from Boys Night Out.
Yeah, man! Welcome to another episode of UNAIDS Protection and Preparedness Education Campaign. In English, PPE.
You are right, DJ MYG. Now, even though there's still a COVID-19 pandemic, let's not forget about the HIV epidemic that is still going on here in the Philippines. Now, from 2010 to 2019, there have been a 207% increase in HIV cases, while approximately 70% know that they're living with the disease.
That's right, Slick. And did you know, last year alone, there have been around 16,000 new HIV cases here in the country. Kailangan talagang seryoso natin itong HIV.
Aba, tama ka dyan. Papi tones, papi slick. Kasi pag sineseryoso mo isang bagay, no, hindi mo iiwan ito, tsaka hindi ka rin iiwan ito. Oh, may hugot pa ng konti. Pero kidding aside, let's all equip ourselves with information and practice to be safe at all times.
Also, with more and more areas being less strict community quarantine protocols, more people can actually start meeting with each other. And so, listen up, DJ Tones, there's more chance of you to know and to actually be exposed to the virus. So it's better to be safe.
You said it, Slick. And this is why we're having this very special episode of the PPE campaign today, as we want everyone to stay prepared, protected, and educated about HIV.
We are requesting everyone to please sit back and, of course, keep your eyes glued on the screen for our HIV awareness crash course.
And to give us a quick rundown about what HIV is and a few tips for prevention, we have with us here today UNAIDS Philippines Country Director Dr. Louie Ocampo to give us a little introduction. Papi Louie, Doc, pasok.
Thank you, boys, for the introduction. What is HIV? HIV stands for Human Immunodeficiency Virus. It is a type of virus that attacks and destroys the body's immune system. We have to know the difference between HIV and AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is a condition of a person with HIV when the immune system is already weak or destroyed and the body can no longer fight off common infections. And AIDS can lead to death. Now, there are body fluids that contain HIV. 1 is blood, 2 semen, 3 vaginal fluid, and 4 breast milk. Based on these body fluids, we can predict the modes of HIV transmission. 1 is penetrative sexual intercourse with an HIV-infected person without condom. This could be through vaginal, oral, or anal sex. And sexual intercourse is the predominant mode of transmission of HIV in the country. The second mode of transmission is from an HIV-infected mother to her infant. This is during pregnancy, labor and delivery, and breastfeeding. The third mode of transmission is sharing of HIV-contaminated syringes and needles. And the last one is through blood transfusion or transplantation of HIV-contaminated blood or blood products. We also have to know that HIV is not transmitted through tears, saliva, sweat, and it's not being transmitted through kissing, sharing of utensils, in the swimming pool, or through mosquito bite and by using toilet bowls. Now, what are the prevention measures that we have? And one of the cornerstone of prevention is the use of condom and lubricants. Considering that the primary mode of transmission is through sexual intercourse, there are a lot of ways to prevent HIV transmission, and one of the cornerstone of prevention is condom use. The other mode of prevention is the use of pre-exposure prophylaxis or a PrEP. This is a kind of drug that is being taken by someone who is HIV negative to prevent transmission of HIV. Is there a cure for HIV? There is no cure, but HIV has a very effective treatment, which we call antiretroviral drugs. Antiretroviral drugs reduce the amount of HIV in the body, and it protects the immune system, it prevents HIV from advancing to AIDS, and it reduces the risk of HIV transmission. Don't worry, HIV is treatable, especially when you are able to detect it early. So make sure to always get yourself tested. But when you get the virus already, there are antiretrovirals and other effective treatments. Pero syempre, we don't want to wait na magkaroon tayo ng HIV. Huwag na natin hintayin because meron namang very effective prevention measure. You should always make it a habit to protect yourself every day, every time you have sex by using condom.
Well, thank you, Doc Louie. It's really interesting to know those facts, and it's something that we neglect if we're actually with someone is to not wear a condom.
But I mean, coming from what Doc was saying, is that it's actually nice that throughout the years, people always thought having HIV is already a death sentence, but now if you're detected early, it's very manageable because there are a lot of drugs out there to help you and to actually live a normal life. And if you go to certain places, it's absolutely for free. So thanks again, Doc Louie, for that very quick and insightful rundown of what HIV is. Now, I'm sure a lot of us is actually watching have learned a thing or two about HIV.
So once again, protect, and protect. Keep that in mind, everyone, especially now that we are slowly being allowed to go out. Although, please bear in mind that we should only go out when necessary and with the proper safety protocols in place.
Okay, to tell us more about how to prevent HIV. Ito, Paps, tinitingnan ko pala yung profile picture. Mukhang iba na datingan, pero matindi to. Our next guest is from, of course, the Love Yourself program. He is the manager, and he's going to talk more about HIV. Let's welcome, Mr. Iosif Cadelina.
Hello, Sam. Hi, everyone. Hi, boys.
Hey.
Thank you for
Ganda ng
having
background natin, Papi. Talagang mukhang prepared.
me. All right, so PPE. You know, guys, the statistics in the Philippines when it comes to HIV is actually we have 35 cases per day, no? And although during the pandemic, as reported by the DOH, cases have actually gone down. So from 35 in 2019, but we also have to note that because of the imposed lockdowns and the quarantine restrictions, there has been less HIV tests done. So we can't really solely attribute this to the decrease in cases. No? So konting nag-test, so konti din yung numbers. Now to compare, we have actually data from the HIV AIDS and Registry of the Philippines from April to June of 2020. The country has 934 confirmed cases from around 2,818 cases in the first quarter of the year. So can you see the drastic difference, the first quarter to the second quarter? So once the quarantine restrictions eased, we again saw an uptick of cases from July to September. Although lower compared to confirmed cases from January to March at 1,875 confirmed cases. So while we are hopeful that these cases are indeed, an indication that the numbers are decreasing, we cannot actually assume that in reality, this is the case because there's just not enough data. A lot of people have not been to testing areas already. But unfortunately, the Philippines has also have the lowest number of condom use in Asia. We only have 30%. So it's very alarming considering that our PLHIV cases are asymptomatic. So they don't have any symptoms at all. They don't know that they're already transferring it. Di nila alam na infected na sila tapos nagpapasa na pala sa iba. Gaya na na-experience natin ngayon with the COVID-19 pandemic. So to further prevent HIV, we should always get ourselves tested, just to be sure. Now, Love Yourself has testing centers across Metro Manila and in the Philippines. So, if you'd like to get tested, feel free to reach out to the numbers listed here on the screen. Don't worry because everything is confidential sa mga gustong magpa-test. Because of the pandemic, we also adjusted our booking systems and we have added an assisted type of HIV service in select areas in Metro Manila. So for more information, you can visit www.loveyourself.ph. So, we should break the stigma about testing for HIV. Early HIV detection is better. There are a lot of groups who are actually going to provide generous guidance and support, so you don't have to face this challenge alone.
Hey, thank you very much, Iosif, for sharing with us how to prevent HIV and for providing us with the details on where we can get ourselves tested for the virus with Love Yourself.
And there are actually other places in the Philippines where you can get tested for HIV. There are DOH-designated HIV treatment hubs and primary HIV care facilities, which you can all go to.
That's correct, Tony. Apart from Love Yourself, there are numerous places Filipinos can and should check out.
That's correct. And so we'd like to invite everyone to stay protected and informed. Be sure to watch out for our other exciting content in the pipeline with our PPE campaign as we celebrate World AIDS Day.
That is correct. Don't forget, during this pandemic, no, pinakamalaga, ligtas ka. Ligtas tone siya, hindi tigas.
Remember, safety is sexy.
And remember to always come prepared.
Thank you guys for watching. Be good and be safe. Yeah,
me.